My name is Şenol Bekmez. I am from Turkey. I work and live in Ankara, the capital city of Turkey. I am an orthopedic surgeon in 15 years practice. I am a professor of orthopedic surgery, and my area of expertise is pediatric orthopedics, which means orthopedic conditions, surgical treatment in children from newborn to 18 years old. And I'm working as a division head in the pediatric orthopedic division in Ankara, the biggest and the busiest children orthopedic center. My area of expertise is any kind of congenital or acquired deformities related to the bone and skeletal system. I am here in Astană now after the very kind invitation from Dr. Chkinayev, a very close friend of mine. We are the part of a close community among many international pediatric orthopedic surgeons in the geography from Russia, Georgia, Azerbaijan, Israel, Turkey, and Kazakhstan. And they invited me to share our knowledge and experience together. And the kind of operations we do here were not done in Kazakhstan before, kind of contemporary treatment in pediatric hip conditions, which means hip joint problems in childhood. So we call it masterclass. It takes a few days, maybe 3 or 4 days, including doing operations, consulting patients together, making the plans and executing the surgeries. And I can call Kazakhstan as my second homeland. Yeah. So the operation we did today is called slipped capital femoral epiphysis, which means common hip condition in adolescent age. Now it became a post-slip deformity. Now the original injury and disease healed, but now we have a deformity. And to correct this deformity needs a comprehensive surgery. We call it safe dislocation of the hip joint, which means we take the hip joint out without damaging its very vulnerable blood circulation. And we gently and meticulously took the hip out and corrected the deformity. And I can say it is not commonly done in many centers, and it requires expertise. And this is why my Kazakh colleagues, my friends, invited me here to execute the surgery together and show them how to do this operation. Yeah, first of all, the most important thing, we treat Kazakh children in Kazakhstan in the government, equipments and resources. So this is not a private organization. Nobody pays. It is in the Kazakh healthcare system, and we bring like a care to Kazakh children. This is the most important thing. But I think second gain, but as important as the first one, we teach them how to do the surgery. The word of Confucius, he says he will not give you fish, instead he will teach you how to fish. So many colleagues around Kazakhstan came up to Astana to attend this surgery, and now they learned how to do it. And in the future, hopefully Kazakh surgeons will do those surgeries once they get enough experience. I think that's the main and most important idea. So I'm trying to help them to broaden their experience and knowledge about how to do the surgery. Yeah, and as well as treating this particular case. That's one gain. But the more important, surgeons will learn how to operate. So it is the most important idea, I think.